Question 1. The audit findings indicate a need to review the integration of historical somatic therapies into current integrative mental health practice. A practitioner is considering incorporating techniques rooted in early 20th century mind-body approaches that have seen a resurgence in popularity. The practitioner must decide how to ethically and effectively address this, considering the evolution of mental health treatment and current regulatory expectations. Which of the following represents the most appropriate professional approach? Option A. Incorporate the historical somatic techniques based on anecdotal evidence and personal experience, prioritizing patient preference over rigorous scientific validation or regulatory compliance. Option B. Immediately implement the historical somatic techniques as they are gaining popularity, assuming their historical use implies inherent value and efficacy without further investigation. Option C. Exclusively rely on the most recent, highly empirical therapeutic modalities, dismissing all historical somatic practices as outdated and irrelevant to modern integrative mental health. Option D. Conduct a thorough review of the historical context and theoretical underpinnings of the somatic therapies, critically evaluate contemporary research on their efficacy and safety, and integrate them responsibly with informed patient consent, aligning with current best practices and ethical guidelines. Correct answer is D. Conduct a thorough review of the historical context and theoretical underpinnings of the somatic therapies, critically evaluate contemporary research on their efficacy and safety, and integrate them responsibly with informed patient consent, aligning with current best practices and ethical guidelines. Explanation. The audit findings indicate a potential disconnect between current integrative mental health practices and the historical evolution of therapeutic approaches, specifically concerning the integration of somatic therapies. This scenario is professionally challenging because it requires the practitioner to navigate the ethical imperative of providing evidence-based care, while also acknowledging and potentially incorporating historically significant, yet sometimes less empirically validated, therapeutic modalities. The tension lies in balancing innovation with established best practices and ensuring patient safety and efficacy, especially when historical practices may have lacked robust oversight or rigorous scientific grounding. The correct approach represents best professional practice because it prioritizes a thorough, evidence-informed review of historical practices and their modern relevance. This involves critically evaluating the historical evolution of somatic therapy, understanding their theoretical underpinnings, and assessing their current efficacy and safety through contemporary research. It aligns with the ethical principles of beneficence and non-maleficence by ensuring that any integration of historical practices is done responsibly, with a clear understanding of potential benefits and risks, and with appropriate patient consent and informed decision-making. This approach also respects the historical context of mental health treatment while upholding the standards of current professional practice. An incorrect approach that involves immediately dismissing all historical somatic therapies without critical evaluation fails to acknowledge the potential value and foundational contributions of these practices to the field. This can lead to a narrow, potentially less holistic approach to care and may overlook effective interventions that have evolved over time. It also risks alienating patients who may have benefited from or are seeking these historically rooted therapies. Another incorrect approach, which is to uncritically adopt historical somatic practices without modern scientific validation or consideration of current ethical guidelines, poses significant risks. This could lead to the use of interventions that are not only ineffective but potentially harmful, violating the principle of non-maleficence. It also disregards the advancements in research, ethical standards, and regulatory frameworks that have shaped modern mental health practice, potentially exposing the practitioner to ethical breaches and regulatory noncompliance. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core issue. Recognize the tension between historical practices and current standards. 2. Gather information. Research the historical context, theoretical basis, and contemporary evidence for the practices in question. 3. Consult ethical guidelines and regulations. Review relevant professional codes of conduct and regulatory requirements for mental health practice. 4. Evaluate efficacy and safety. Critically assess the evidence base for both historical and modern applications. 5. Consider patient-centered care. Determine how the integration of practices aligns with individual patient needs, preferences, and informed consent. 6. Seek supervision or consultation, Engage with peers or supervisors to discuss complex ethical and clinical dilemmas. 7. Document decisions. Maintain clear records of the evaluation process and the rationale for chosen interventions. Question 2. Implementation of a client's treatment plan requires a mental health professional certified in integrative mental health (CIMHP) to evaluate the most appropriate combination of therapeutic modalities. Considering a client presenting with moderate anxiety and a history of adverse reactions to several psychotropic medications, which of the following approaches best aligns with CIMHP best practices and ethical considerations? Option A. Prescribe a broad-spectrum anxiolytic medication, as this is the standard of care for moderate anxiety, and defer any discussion of integrative therapies until the medication has proven ineffective. Option B. Develop a treatment plan that prioritizes evidence-based mindfulness-based stress reduction techniques and cognitive behavioral therapy, while also exploring the potential benefits of nutritional counseling and gentle yoga, with ongoing monitoring for client response and adjustment. Option C. Recommend a strict regimen of high-intensity interval training and a ketogenic diet, asserting that these lifestyle changes are sufficient to address the client's anxiety without the need for further psychological intervention. Option D. Focus exclusively on a novel, experimental energy healing modality that has shown anecdotal promise in online forums without incorporating any traditional therapeutic interventions. The correct answer is B. Develop a treatment plan that prioritizes evidence-based mindfulness-based stress reduction techniques and cognitive behavioral therapy, while also exploring the potential benefits of nutritional counseling and gentle yoga, with ongoing monitoring for client response and adjustment. Explanation. This scenario presents a professional challenge in balancing established, evidence-based traditional mental health interventions with emerging integrative approaches, particularly when considering client outcomes and resource allocation within the scope of practice defined by the Certification in Integrative Mental Health (CIMHP) framework. The core tension lies in evaluating the efficacy and ethical implications of incorporating non-pharmacological, holistic modalities alongside or in place of conventional treatments, all while adhering to the specific regulatory and ethical guidelines governing CIMHP practitioners. Careful judgment is required to ensure client safety, informed consent, and the delivery of care that is both effective and aligned with professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that informs a personalized treatment plan. This plan judiciously integrates evidence-informed traditional interventions with complementary integrative modalities, recognizing that the CIMHP framework encourages a holistic view of well-being. This approach aligns with ethical principles of beneficence and non-maleficence by seeking to maximize client benefit while minimizing harm, and it upholds the professional responsibility to stay abreast of evolving best practices in integrative mental health. Furthermore, it respects the client's autonomy by involving them in the decision-making process regarding their care. An incorrect approach that relies solely on traditional pharmacological interventions without exploring complementary strategies fails to fully leverage the integrative scope of practice and may overlook potential benefits of non-pharmacological approaches for certain clients, potentially limiting optimal outcomes. This could be seen as a failure to adhere to the spirit of integrative mental health practice as defined by CIMHP, which advocates for a broader toolkit. Another incorrect approach that exclusively adopts unproven or poorly researched integrative modalities without a foundation in traditional, evidence-based care risks client harm and violates the ethical duty to provide competent care. This would be a direct contravention of the principle of evidence-informed practice, cornerstone of professional mental health services, and could lead to regulatory scrutiny for practicing outside of established competencies. A third incorrect approach that dismisses the client's expressed interest in integrative therapies in favor of a rigid, traditional model disregards client autonomy and the collaborative nature of treatment planning, potentially eroding the therapeutic alliance and leading to disengagement from care. Professional decision-making in similar situations requires a systematic process. First, conduct a thorough assessment of the client's needs, preferences, and history. Second, evaluate the evidence base for both traditional and integrative interventions relevant to the client's presentation. Third, consult relevant professional guidelines and ethical codes, including those specific to CIMHP. Fourth, engage in open and honest communication with the client about all available treatment options, their potential benefits, risks, and limitations, ensuring informed consent. Finally, develop a collaborative treatment plan that is tailored to the individual client, incorporating a judicious blend of approaches that are safe, effective, and ethically sound. Question 3. System analysis indicates that an integrative mental health professional is presented with a new client experiencing a complex interplay of anxiety symptoms and interpersonal relationship difficulties. The professional has a broad range of assessment tools available. To ensure the most effective and ethically sound initial assessment, which of the following approaches best aligns with the regulatory framework and guidelines for the certification in integrative mental health CIMHP? Option A. Rely primarily on unstructured clinical interviews and the professional's subjective experience to gather information, as standardized tools can sometimes be too rigid. Option B. Select a widely recognized and frequently used assessment tool for anxiety, assuming it will also adequately capture the interpersonal difficulties due to their common co-occurrence. Option C. Utilize a newly developed, cutting-edge assessment tool that promises a more comprehensive overview, even if its psychometric data is still preliminary. Option D. Prioritize an assessment tool that has demonstrated strong psychometric properties, validity, and reliability for both anxiety and interpersonal functioning, and is culturally appropriate for the client's background. The correct answer is B. Select a widely recognized and frequently used assessment tool for anxiety, assuming it will also adequately capture the interpersonal difficulties due to their common co-occurrence. Explanation. This scenario presents a professional challenge due to the ethical and regulatory imperative to utilize evidence-based practices, which includes the appropriate selection and application of standardized assessment tools. The integrative mental health professional must balance the need for efficient and reliable data collection with the client's unique needs and the limitations of any given tool. Careful judgment is required to ensure that the chosen assessment tool is not only valid and reliable, but also culturally sensitive and appropriate for the presenting concerns, thereby avoiding misdiagnosis or incomplete understanding of the client's situation. The correct approach represents best professional practice because it prioritizes a systematic and informed selection process for assessment tools. This involves a thorough review of the client's presenting problem, consideration of the tool's psychometric properties, validity, reliability, cultural appropriateness, and alignment with the CIMHP ethical guidelines and regulatory framework. This ensures that the assessment is comprehensive, accurate, and respects the client's individuality, leading to more effective and ethical treatment planning. Adherence to the CIMHP standards for practice, which emphasize evidence-based interventions and client-centered care, is paramount. An incorrect approach that involves selecting a tool solely based on its widespread popularity or ease of administration fails to meet the professional standard. This overlooks the critical need for psychometric rigor and may lead to inaccurate or irrelevant data, potentially causing harm to the client through misdiagnosis or inappropriate treatment. This violates the ethical principle of competence and the regulatory requirement to practice within one's scope and utilize validated methods. Another incorrect approach, choosing a tool that is not culturally adapted or validated for the client's specific demographic, represents a significant ethical and regulatory failure. This can lead to biased results, misinterpretation of symptoms, and a breakdown in the therapeutic alliance, contravening the CIMHP emphasis on cultural humility and equitable care. It also fails to adhere to the principle of beneficence by not ensuring the assessment is truly beneficial and accurate for the individual. A further incorrect approach, relying on informal observation and subjective impressions without the support of a standardized tool, neglects the importance of objective and quantifiable data in mental health assessment. While clinical intuition is valuable, it must be supplemented by standardized measures to ensure reliability and validity, as mandated by professional standards and regulatory bodies that promote evidence-based practice. This approach risks introducing personal bias and lacks the systematic rigor expected in professional mental health practice. The professional decision-making process for similar situations should involve a structured approach. 1. Clearly define the client's presenting concerns and goals. 2. Research available standardized assessment tools relevant to those concerns. 3. Critically evaluate the psychometric properties, validity, reliability, and cultural appropriateness of potential tools. 4. Consider the client's preferences and any practical limitations. 5. Select the most suitable tool based on this comprehensive evaluation, ensuring it aligns with CIMHP ethical and regulatory standards. Question 4. Operational review demonstrates that client presents with significant anxiety and social withdrawal. The mental health professional is considering how to best understand and address these issues within the framework of the certification in Integrative Mental Health (CIMHP). Which of the following approaches most accurately reflects the application of systems theory in this context? Option A. Recommend a course of medication to manage the anxiety symptoms, deferring any exploration of behavioral or relational factors until the medication has stabilized the client. Option B. Explore the client's relational dynamics within their family and social networks, examining communication patterns, roles, and environmental stressors that may be influencing their current presentation. Option C. Primarily focus on identifying and modifying the client's individual negative thought patterns and core beliefs contributing to their anxiety and withdrawal. Option D. Immediately initiate family therapy sessions to address perceived dysfunctional communication patterns within the client's household, without prior explicit consent for this specific intervention. The correct answer is C. Primarily focus on identifying and modifying the client's individual negative thought patterns and core beliefs contributing to their anxiety and withdrawal. Explanation: this scenario is professionally challenging because it requires the mental health professional to navigate the complex interplay of individual client needs within the broader context of their family and social systems, while adhering to the specific ethical and regulatory standards of the certification in Integrative Mental Health (CIMHP) framework. The core of the challenge lies in identifying and intervening with systemic patterns that may be contributing to or maintaining the client's distress, rather than solely focusing on individual pathology. This demands a nuanced understanding of how relationships, communication patterns, and environmental factors influence mental well-being, all within the bounds of professional competence and client consent. The correct approach, which emphasizes understanding the client's presenting issues through the lens of systems theory, by exploring their relational dynamics and environmental influences, represents best professional practice. This aligns with the CIMHP commitment to integrative approaches, which inherently recognize the interconnectedness of various factors impacting mental health. Specifically, this approach respects the ethical imperative to consider the whole person and their context, promoting a more holistic and effective intervention. It also implicitly adheres to guidelines that encourage practitioners to assess and address the broader influences on a client's well-being, moving beyond a purely individualistic model. An incorrect approach that focuses exclusively on individual cognitive distortions, without acknowledging the systemic context, fails to meet the integrative mandate of CIMHP. This approach risks oversimplifying the client's experience and may lead to interventions that are less effective, because they do not address the root causes embedded within the client's relational or environmental systems. Ethically, this could be seen as a failure to provide comprehensive care by neglecting significant contributing factors. Another incorrect approach that involves directly intervening in family dynamics without explicit client consent or a clear understanding of the systemic boundaries and potential repercussions would be a significant ethical and regulatory failure. This could violate client autonomy, breach confidentiality, and potentially destabilize the system in ways that are detrimental to the client's well-being. CIMHP guidelines would mandate a careful, consent-driven, and ethically sound approach to any systemic intervention. The professional decision-making process for similar situations should involve a thorough assessment that explicitly considers the client's presenting problem within their various systems: family, social, cultural, environmental. This assessment should inform the development of an intervention plan that is integrative, client-centered, and ethically sound, always prioritizing client consent and professional competence. When considering systemic intervention, a phased approach involving education, exploration of relational patterns, and collaborative goal setting with the client is crucial before any direct systemic engagement. Question 5. Strategic planning requires a CIMHP practitioner to consider how to best support a client who expresses a strong desire to incorporate a specific, novel integrative modality into their treatment plan, which the practitioner has limited direct experience with, and for which robust scientific evidence is still emerging. How should the practitioner proceed to ensure ethical and effective care? Option A. Immediately agree to incorporate the novel modality as requested by the client to honor their autonomy and build rapport, deferring further investigation until after the initial implementation. Option B. Engage in a thorough assessment of the client's overall health and well-being. Discuss the emerging evidence and potential risks/benefits of the requested modality. Explore alternative evidence-informed integrative approaches, and collaboratively develop a treatment plan that prioritizes safety and efficacy. Option C. Focus exclusively on the client's stated preference for the novel modality, dedicating the majority of the therapeutic time to researching and implementing it, regardless of its current evidence base or potential impact on other aspects of their health. Option D. Firmly reject the client's request for the novel modality, explaining that it falls outside the scope of established CIMHP practices and recommending only traditional, well-researched interventions. The correct answer is B. Engage in a thorough assessment of the client's overall health and well-being. Discuss the emerging evidence and potential risks/benefits of the requested modality. Explore alternative evidence-informed integrative approaches, and collaboratively develop a treatment plan that prioritizes safety and efficacy. Explanation. This scenario presents a professional challenge because it requires balancing a client's expressed desire for a specific integrative modality with the practitioner's ethical obligation to provide evidence-informed care and ensure client safety, all within the regulatory framework of the Certification in Integrative Mental Health (CIMHP). The practitioner must navigate the potential for a client to pursue unproven or potentially harmful interventions while respecting client autonomy. Careful judgment is required to assess the client's understanding, the scientific validity of the proposed modality, and the potential risks and benefits. The correct approach represents best professional practice because it prioritizes the client's well-being and adheres to the CIMHP ethical guidelines, which emphasize evidence-informed practice and the avoidance of harm. This involves a thorough assessment of the client's needs and goals, a discussion of evidence-based integrative options, and a collaborative decision-making process. The practitioner's role is to educate, guide, and ensure that any chosen interventions are safe, appropriate, and aligned with the client's overall health objectives, rather than simply acceding to a client's request for a specific, potentially unvalidated treatment. This upholds the principle of beneficence and non-maleficence. An incorrect approach that involves immediately agreeing to the client's requested modality without critical evaluation fails to uphold the practitioner's responsibility to provide evidence-informed care. This could lead to the client engaging in ineffective or even harmful practices, violating the CIMHP ethical mandate to practice within one's scope and with due regard for scientific evidence. Another incorrect approach, that of dismissing the client's request outright without exploration, disrespects client autonomy and the therapeutic alliance, potentially alienating the client and hindering their engagement with more beneficial integrative approaches. A third incorrect approach, focusing solely on the client's stated desire without considering the broader holistic context of their health, neglects the core principles of integrative mental health, which emphasize the interconnectedness of mind, body, and spirit. Professional decision-making in such situations should involve a structured process. First, actively listen to and understand the client's request and underlying motivations. Second, assess the client's current health status and needs holistically. Third, critically evaluate the requested modality based on available scientific evidence, safety, and ethical considerations relevant to CIMHP. Fourth, educate the client about evidence-based integrative options, including the rationale, potential benefits, risks, and alternatives. Fifth, engage in shared decision-making, empowering the client to make informed choices while guiding them towards the safest and most effective path. Question 6. Investigation of a client presenting with feelings of profound emptiness and a questioning of life's purpose, who expresses a sense of detachment from their usual activities and relationships, requires the integrative mental health professional to consider various theoretical frameworks. Which of the following approaches best aligns with humanistic and existential theories in addressing this client's concerns? Option A. Providing the client with philosophical texts and lectures on the nature of existence and meaning, with the expectation that intellectual understanding will resolve their distress. Option B. Encouraging the client to engage in more social activities and hobbies, suggesting they focus on practical goals to distract from their feelings of emptiness and existential questioning. Option C. Administering a standardized diagnostic assessment for depression and anxiety, and initiating a course of cognitive behavioral therapy focused on challenging negative thought patterns related to their perceived lack of purpose. Option D. Facilitating a deep exploration of the client's subjective experience of meaninglessness, their personal values, and their search for authentic self-expression, while collaboratively identifying potential avenues for meaning-making. The correct answer is D, facilitating a deep exploration of the client's subjective experience of meaninglessness, their personal values, and their search for authentic self-expression, while collaboratively identifying potential avenues for meaning-making. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing a client's existential distress and the potential for misinterpreting their search for meaning as a symptom requiring immediate intervention without fully exploring their lived experience. The integrative mental health professional must balance the need for evidence-based practice with the humanistic and existential emphasis on individual autonomy and the client's unique perspective. The correct approach represents best professional practice because it prioritizes a client-centered, phenomenological exploration aligned with humanistic and existential principles. By focusing on understanding the client's subjective experience of meaninglessness, their values, and their personal journey, the professional respects their autonomy and facilitates self-discovery. This aligns with the CIMHP framework's emphasis on holistic well-being and the client's inherent capacity for growth and self-actualization, as well as ethical guidelines that mandate informed consent and a collaborative therapeutic relationship. The professional is not imposing a diagnosis, but rather co-creating understanding. An incorrect approach that focuses solely on diagnosing a specific mental health disorder without adequately exploring the existential context fails to acknowledge the client's unique narrative and may lead to premature or inappropriate interventions. This could be a regulatory or ethical failure if it bypasses the client's right to self-determination and a comprehensive assessment that considers their existential concerns. Another incorrect approach that attempts to fix the client's feelings of meaninglessness by imposing external solutions or prescribed meanings disregards the existential tenet that meaning is often found through personal struggle and authentic engagement with life. This would be ethically problematic, as it undermines the client's agency and their capacity to find their own answers. A third incorrect approach that dismisses the client's existential concerns as simply a phase or a lack of willpower fails to recognize the profound impact of existential questions on mental well-being and would be a significant ethical lapse in providing competent and compassionate care. The professional decision-making process for similar situations should involve a thorough assessment that integrates the client's subjective experience with any presenting symptoms. This includes actively listening to the client's narrative, exploring their values and beliefs, and understanding their perception of their life's meaning. The professional should then collaboratively develop a treatment plan that honors the client's existential concerns, drawing upon appropriate humanistic and existential interventions while remaining mindful of CIMHP standards and ethical obligations. The focus should always be on empowering the client to explore their own path to meaning and well-being. Question 7. What factors determine the appropriate integration of transpersonal psychology concepts into a CIMHP-certified professional's practice when addressing a client's existential distress and search for meaning? Option A. The client's expressed readiness and capacity to engage with existential themes, the professional's demonstrated competence in transpersonal frameworks, and the clear articulation of how these concepts will be integrated into a broader, evidence-informed mental health treatment plan. Option B. The extent to which transpersonal psychology can be used to bypass or reframe conventional diagnostic criteria, allowing for a more holistic, albeit less empirically validated, understanding of the client's experiences. Option C. The availability of transpersonal psychology literature and the professional's ability to introduce abstract philosophical concepts without necessarily linking them to the client's immediate psychological functioning or therapeutic goals. Option D. The professional's personal belief system regarding spirituality and the client's perceived openness to exploring non-traditional healing modalities, regardless of their direct relevance to the presenting mental health concerns. The correct answer is A. The client's expressed readiness and capacity to engage with existential themes, the professional's demonstrated competence in transpersonal frameworks, and the clear articulation of how these concepts will be integrated into a broader, evidence-informed mental health treatment plan. Explanation. This scenario presents a professional challenge due to the inherent subjectivity and diverse interpretations within transpersonal psychology, particularly when applied to mental health assessment and intervention within a regulated framework like the certification in Integrative Mental Health, CIMHP. Professionals must navigate the boundary between evidence-based practices and the more experiential, spiritual, or existential dimensions explored in transpersonal approaches, ensuring client safety, efficacy, and adherence to professional standards. The challenge lies in integrating these broader human experiences without compromising the core principles of mental health care or violating regulatory expectations for competence and ethical practice. The correct approach represents best professional practice because it prioritizes a client-centered framework that acknowledges the potential benefits of transpersonal concepts while grounding interventions in established psychological principles and the CIMHP ethical guidelines. This involves a thorough assessment of the client's presenting issues, their readiness for exploring transpersonal dimensions, and ensuring that any such exploration is integrated into a broader therapeutic plan that addresses their mental health needs. It emphasizes informed consent, cultural sensitivity, and the professional's competence in facilitating such explorations, aligning with the CIMHP commitment to ethical and effective integrative mental health care. An incorrect approach that focuses solely on abstract spiritual or philosophical concepts without a clear link to the client's mental health presentation or a structured therapeutic process fails to meet professional standards. This could lead to a lack of measurable progress, potential for client disorientation or distress if not handled competently, and a deviation from the core mandate of mental health support. Such an approach might also be seen as overstepping professional boundaries by engaging in spiritual counseling without adequate training or by imposing personal beliefs. Another incorrect approach that dismisses or pathologizes transpersonal experiences as inherently indicative of mental illness without thorough assessment is also professionally unacceptable. This fails to recognize the valid and often beneficial role that spiritual, existential, and peak experiences can play in an individual's well-being and recovery. It demonstrates a lack of cultural competence and an overly narrow view of mental health, potentially alienating clients and hindering therapeutic progress. The professional decision-making process for similar situations should involve a systematic evaluation of the client's needs and goals, a critical assessment of the applicability and ethical implications of any theoretical framework, including transpersonal psychology, and a commitment to ongoing professional development and supervision. Professionals must ask, is this approach client-centered? Is it evidence-informed or based on sound theoretical principles applicable to mental health? Am I competent to facilitate this? Does it align with ethical guidelines and regulatory requirements? Is informed consent adequately obtained and maintained? Question 8. When evaluating a client presenting with increased fatigue, sleep disturbances, and a perceived decrease in motivation, which are also noted as potential side effects of a recently prescribed medication for a chronic physical condition, what is the most appropriate initial course of action within the CIMHP framework? Option A. Suggest the client increase their dosage of the prescribed medication, believing it may help alleviate their perceived lack of motivation. Option B. Advise the client to discontinue the medication immediately, as it is likely contributing to their current mental health symptoms. Option C. Immediately initiate a course of cognitive behavioral therapy focused on addressing the client's depressive symptoms and motivational deficits. Option D. Recommend a consultation with the client's prescribing physician to discuss the potential medication side effects and explore alternative treatment options or dosage adjustments. The correct answer is D. Recommend a consultation with the client's prescribing physician to discuss the potential medication side effects and explore alternative treatment options or dosage adjustments. Explanation. This scenario presents a professional challenge because the client's presentation of symptoms, while potentially indicative of a depressive episode, also overlaps with common side effects of prescribed medication. A mental health professional must exercise careful judgment to differentiate between a primary mental health condition requiring therapeutic intervention and a physiological response to medication that might necessitate consultation with the prescribing physician. The CIMHP framework emphasizes a holistic and integrative approach, which includes considering biological factors alongside psychological and social ones. The correct approach represents best professional practice because it prioritizes a thorough assessment that considers all contributing factors. By recognizing the potential impact of medication and recommending a consultation with the prescribing physician, the professional adheres to ethical guidelines that mandate collaboration with other healthcare providers and avoid making diagnostic or treatment decisions outside their scope of practice or without considering all relevant information. This aligns with the CIMHP emphasis on interdisciplinary care and patient safety, ensuring that the client receives appropriate and coordinated care. An incorrect approach that focuses solely on initiating cognitive behavioral therapy, CBT, without addressing the potential medication side effects fails to conduct a comprehensive assessment. This could lead to misdiagnosis and inappropriate treatment, potentially delaying necessary medical intervention or exacerbating the client's condition. Ethically, this approach could be seen as a failure to gather sufficient information and a premature application of therapeutic techniques without a full understanding of the client's presenting problem. Another incorrect approach that involves adjusting the client's medication dosage without consulting the prescribing physician is a clear violation of professional boundaries and regulatory frameworks. Mental health professionals, unless specifically licensed and qualified as prescribers, do not have the authority to alter medication regimens. This constitutes practicing outside the scope of practice and poses a significant risk to patient safety, potentially leading to adverse drug reactions or ineffective treatment. A third incorrect approach that dismisses the client's concerns about medication as simply a manifestation of their underlying condition overlooks the possibility of a physiological cause. This demonstrates a lack of open-mindedness and a failure to integrate all available data into the assessment. Ethically, it can be viewed as invalidating the client's experience and potentially leading to a misdiagnosis of a medication-related issue. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive assessment, gathering information about the client's history, current symptoms, and any relevant biological factors, including current medications. 2. Differentiate between psychological and physiological causes of symptoms, considering potential interactions or side effects of prescribed treatments. 3. Collaborate with other healthcare professionals, such as physicians, when medical factors are suspected or identified. 4. Develop a treatment plan that is evidence-based, client-centered, and addresses all identified contributing factors. 5. Continuously monitor the client's progress and adjust the treatment plan as needed, always maintaining ethical and regulatory compliance. Question 9. The efficiency study reveals that a novel neurofeedback protocol, utilizing specific brainwave patterns identified through recent neuroscience research, shows promising preliminary results in reducing reported anxiety symptoms in a small, homogeneous sample group. As a certified integrative mental health professional, what is the most ethically sound and professionally responsible course of action regarding this protocol? Option A. Critically evaluate the study's methodology and limitations, research for corroborating evidence, and consider the protocol's applicability and safety for individual clients within a broader, evidence-based treatment plan, while maintaining transparency with clients about the research status. Option B. Dismiss the study as preliminary and not yet relevant for clinical practice, continuing to rely solely on established therapeutic modalities without further investigation. Option C. Develop and market the new neurofeedback protocol as a primary treatment for anxiety, focusing on its novelty and the potential for rapid symptom improvement to attract clients. Option D. Immediately incorporate the neurofeedback protocol into your practice for all clients experiencing anxiety, given the study's positive findings and the potential to offer a cutting-edge intervention. The correct answer is A. Critically evaluate the study's methodology and limitations, research for corroborating evidence, and consider the protocol's applicability and safety for individual clients within a broader, evidence-based treatment plan, while maintaining transparency with clients about the research status. Explanation. This scenario presents a professional challenge due to the inherent tension between the desire to leverage emerging neuroscience findings for client benefit and the ethical imperative to ensure interventions are evidence-based, safe, and within the scope of practice. The integrative mental health professional must navigate the potential for overinterpretation of preliminary research and the risk of offering unproven treatments. The correct approach represents best professional practice because it prioritizes client well-being and adheres to the core principles of ethical practice in integrative mental health. This involves a commitment to ongoing, critical evaluation of scientific literature, understanding the limitations of current research, and integrating new knowledge judiciously into practice only when supported by robust evidence and deemed appropriate for the individual client's needs and circumstances. This aligns with the ethical guidelines of the Certification in Integrative Mental Health, CIMHP, which emphasize evidence-based practice, client autonomy, and professional competence. Specifically, it upholds the principle of do no harm by avoiding the premature adoption of interventions that may be ineffective or even detrimental. An incorrect approach that involves immediately implementing a novel neurofeedback protocol based solely on a single efficiency study, without further validation or consideration of individual client suitability, represents a significant ethical failure. This could violate the principle of informed consent, as clients may not fully understand the experimental nature of the intervention or its potential risks and benefits. It also risks practicing outside the scope of established, evidence-based interventions, potentially leading to client harm or dissatisfaction. Another incorrect approach, such as dismissing the study entirely due to its preliminary nature, without considering its potential implications or areas for future research, could be seen as a failure to stay abreast of advancements in the field, which is also an ethical consideration for maintaining professional competence. A third incorrect approach, focusing solely on the potential for financial gain from offering a new service without adequate ethical and scientific vetting, is a clear violation of professional integrity and client welfare. Professionals should employ a decision-making framework that involves 1. Critical appraisal of research, evaluating the methodology, sample size, statistical significance, and generalizability of findings. 2. Consideration of client factors, assessing individual needs, preferences, contraindications, and potential for benefit. 3. Consultation and collaboration, seeking input from peers, supervisors, or experts in the relevant neuroscience area. 4. Gradual integration, piloting new approaches with careful monitoring and data collection before widespread adoption. 5. Transparency with clients, ensuring clients are fully informed about the evidence base, potential risks, and benefits of any proposed intervention. Question 10. Cost-benefit analysis shows that incorporating evidence-informed neuroplasticity techniques into a mental health recovery plan can offer significant advantages for clients experiencing persistent symptoms, but requires careful consideration of professional competence and client consent. A CIMHP-certified professional is assessing a client with a history of treatment-resistant depression. Which of the following approaches best aligns with regulatory and ethical best practices for integrating neuroplasticity-focused interventions? Option A. Advise the client that neuroplasticity is an unproven concept in mental health and therefore cannot be considered as part of their treatment plan, regardless of emerging research. Option B. Proceed with implementing a novel neuroplasticity-based protocol immediately, based on promising research findings, without further client discussion or formal assessment of the professional's specific training in that protocol. Option C. Conduct a thorough assessment of the client's needs and goals, review the current evidence for neuroplasticity techniques relevant to the client's condition, ensure personal competence through appropriate training, and obtain explicit informed consent from the client regarding the proposed intervention, its rationale, potential benefits, risks, and alternatives. Option D. Utilize a neuroplasticity technique that the professional has only read about in popular science articles, without verifying its efficacy through peer-reviewed literature or seeking specialized training, and present it as a guaranteed solution for the client's depression. The correct answer is B. Proceed with implementing a novel neuroplasticity-based protocol immediately, based on promising research findings, without further client discussion or formal assessment of the professional's specific training in that protocol. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health professional to balance the potential benefits of an emerging, evidence-informed intervention, neuroplasticity-focused techniques, with the need for adherence to established regulatory frameworks and ethical guidelines. The rapid evolution of neuroplasticity research means that, while promising, its application in clinical practice may not yet be fully codified or universally accepted within all regulatory bodies. Professionals must navigate the ethical imperative to offer effective treatments while ensuring patient safety, informed consent, and scope of practice limitations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient well-being and ethical conduct by grounding interventions in established, evidence-based practices, while cautiously integrating novel approaches like neuroplasticity-focused techniques. This involves thorough assessment, clear communication with the client about the nature of the intervention, its potential benefits and risks, and ensuring that the professional has the necessary training and competence. Adherence to the certification in integrative mental health, CIMHP, guidelines, which likely emphasize evidence-informed practice and ethical considerations, is paramount. This approach ensures that the client's autonomy is respected through informed consent, and that the professional operates within their scope of practice, avoiding unproven or potentially harmful interventions. Incorrect approaches analysis. An approach that solely relies on anecdotal evidence or personal enthusiasm for neuroplasticity without rigorous assessment or client consent would be a significant ethical and regulatory failure. This could lead to providing interventions outside of one's expertise or without adequate understanding of potential contraindications, violating the principle of do no harm and potentially breaching CIMHP standards regarding evidence-based practice. Another incorrect approach would be to dismiss neuroplasticity-based interventions entirely due to their novelty, even when there is emerging evidence of efficacy. This could be considered a failure to stay abreast of advancements in the field and could limit a client's access to potentially beneficial treatments, contradicting the CIMHP likely aim of promoting integrative and effective mental health care. Finally, an approach that misrepresents the scientific backing of neuroplasticity techniques or overpromises outcomes would constitute a breach of ethical conduct, specifically regarding honesty and integrity in professional practice. This could lead to client disappointment, loss of trust, and potential harm if the client relies on unsubstantiated claims. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive client assessment to identify specific needs and goals. This is followed by a thorough review of current, evidence-based treatment modalities, including emerging research on neuroplasticity. When considering novel interventions, professionals must critically evaluate the strength of the evidence, their own competence and training, and the potential risks and benefits for the individual client. Informed consent is a crucial step, ensuring the client understands the intervention, its rationale, and alternatives. Adherence to the specific regulatory framework and ethical guidelines of the CIMHP is non-negotiable throughout this process. Question 11. System analysis indicates that a client diagnosed with a major depressive disorder reports significant interest in exploring dietary interventions to complement their ongoing psychotherapy. The CIMHP is tasked with evaluating the best approach to guide this client regarding dietary patterns associated with mental health disorders, adhering strictly to CIMHP regulatory frameworks and best practices. Which of the following represents the most appropriate and ethically sound approach for the CIMHP? Option A. Provide the client with a detailed meal plan for a highly restrictive elimination diet, claiming it can detoxify the body and resolve depressive symptoms without consulting other healthcare professionals. Option B. Encourage the client to follow popular online wellness gurus who promote specific superfood smoothies and supplements for mental clarity, as these are often perceived as natural and safe. Option C. Recommend a Mediterranean-style dietary pattern, emphasizing its research-backed benefits for mood regulation and cognitive function, while advising the client to discuss any significant dietary changes with their primary care physician and a registered dietitian. Option D. Advise the client to adopt a ketogenic diet, citing anecdotal evidence of its positive effects on brain health and mood, and suggest they monitor their symptoms closely. The correct answer is C. Recommend a Mediterranean-style dietary pattern, emphasizing its research-backed benefits for mood regulation and cognitive function, while advising the client to discuss any significant dietary changes with their primary care physician and a registered dietitian. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified integrative mental health professional CIMHP by requiring them to evaluate the efficacy of dietary interventions for a client with a diagnosed mental health disorder. The challenge lies in navigating the complex interplay between nutrition, mental well-being, and evidence-based practice, while adhering strictly to the CIMHP scope of practice and regulatory guidelines. Professionals must exercise careful judgment to distinguish between scientifically supported dietary patterns and unsubstantiated claims, ensuring client safety and promoting effective, ethical care. Correct approach analysis. The correct approach involves critically evaluating the scientific literature and established dietary guidelines relevant to mental health. This aligns with best professional practice by prioritizing evidence-based interventions and maintaining a scope of practice that is within the CIMHP training and certification. CIMHP professionals are expected to integrate knowledge of nutrition's impact on mental health, but their role is typically advisory and supportive, not prescriptive in the manner of a registered dietitian or medical doctor. Therefore, recommending dietary patterns supported by robust research and established public health recommendations, while acknowledging limitations and the need for multidisciplinary collaboration, represents the most ethical and effective strategy. This approach respects the client's autonomy and promotes informed decision-making based on reliable information. Incorrect approaches analysis, recommending a specific, highly restrictive, or experimental dietary regimen without strong scientific backing or consultation with a qualified healthcare provider, constitutes a significant regulatory and ethical failure. This could lead to nutritional deficiencies, exacerbate existing health conditions, or create a false sense of hope, delaying or interfering with evidence-based medical or psychological treatments. Such an approach oversteps the CIMHP scope of practice, potentially engaging in the unauthorized practice of dietetics or medicine. Furthermore, relying on anecdotal evidence or popular but unproven dietary trends violates the principle of evidence-based practice, which is foundational to professional integrity and client safety. Failing to acknowledge the need for multidisciplinary collaboration when addressing complex health issues like mental disorders, especially when incorporating significant dietary changes, is also an ethical lapse. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment of the client's current health status, mental health diagnosis, and existing dietary habits. They should then consult reputable, peer-reviewed scientific literature and establish professional guidelines from recognized health organizations. The focus should be on identifying dietary patterns that have demonstrated a positive association with mental well-being, such as those rich in whole foods, healthy fats, and micronutrients, while being mindful of potential contraindications or interactions with medications. Crucially, CIMHP professionals must recognize the boundaries of their expertise and collaborate with other healthcare providers, such as physicians and registered dietitians, when dietary interventions become complex or involve significant changes. This collaborative approach ensures comprehensive and safe care, respecting each professional's distinct role and expertise. Question 12. The assessment process reveals that a client, who recently immigrated from a collectivist culture with a strong emphasis on family honor, is presenting with symptoms of anxiety and withdrawal. The client's family has expressed concern about the client's perceived shame brought upon the family due to these symptoms. The clinician is considering how to best proceed with the assessment, balancing the client's individual experience with the family's cultural context. Option A. Prioritize understanding the client's symptoms through the lens of their cultural background, exploring how concepts of family honor and shame might influence their presentation and their willingness to engage in certain therapeutic interventions. Option B. Focus solely on the client's individual psychological distress, explaining to the family that mental health is a personal matter and that their cultural interpretations of shame are not directly relevant to the clinical assessment. Option C. Administer standard diagnostic questionnaires without modification, assuming that mental health symptoms are universally experienced and expressed, and then explain the results to the client and family in a direct, westernized clinical manner. Option D. Interpret the client's withdrawal as a direct sign of depression and the family's concern about shame as an indication of their lack of understanding of mental health, proceeding with a treatment plan focused on individual coping mechanisms without further cultural exploration. The correct answer is A. Prioritize understanding the client's symptoms through the lens of their cultural background, exploring how concepts of family honor and shame might influence their presentation and their willingness to engage in certain therapeutic interventions. Explanation. This scenario presents a professional challenge due to the potential for cultural misunderstandings to significantly impact the accuracy and appropriateness of a mental health assessment. The clinician must navigate the client's cultural background, which may influence their communication style, understanding of mental health concepts, and willingness to disclose certain information. Careful judgment is required to ensure the assessment is culturally sensitive and valid, avoiding misinterpretations that could lead to an incorrect diagnosis or inappropriate treatment plan. The correct approach represents best professional practice, because it prioritizes cultural humility and competence. This involves actively seeking to understand the client's cultural context, acknowledging potential biases, and adapting assessment methods accordingly. This aligns with ethical guidelines that mandate providing culturally responsive care and respecting client diversity. Specifically, it upholds the principle of beneficence by ensuring the assessment is tailored to the client's unique needs and experiences, thereby maximizing the potential for positive outcomes. It also adheres to principles of justice by ensuring equitable assessment regardless of cultural background. An incorrect approach that relies solely on standardized, culturally invariant assessment tools without considering the client's background fails to acknowledge the impact of culture on mental health presentation and expression. This can lead to misinterpretation of symptoms, potentially resulting in a misdiagnosis or an ineffective treatment plan, violating the principle of non-maleficence. It also demonstrates a lack of cultural competence, which is an ethical imperative in mental health practice. Another incorrect approach that assumes the client's cultural norms are irrelevant or secondary to a universal understanding of mental health disregards the profound influence of culture. This can alienate the client, erode trust, and lead to incomplete or inaccurate information being gathered, hindering the therapeutic alliance and the effectiveness of the assessment. This approach fails to uphold the ethical duty to respect client autonomy and dignity by not acknowledging their lived experience within their cultural framework. A further incorrect approach that imposes the clinician's own cultural interpretations onto the client's experiences without seeking clarification or validation is a form of cultural imposition. This can lead to significant misunderstandings and can be deeply invalidating for the client, potentially causing harm and undermining the therapeutic relationship. It is ethically unsound as it prioritizes the clinician's perspective over the client's lived reality and fails to adhere to the principle of informed consent, as the client's understanding of the assessment process may be compromised. The professional decision-making process for similar situations should involve a continuous cycle of self-reflection, cultural knowledge acquisition, and skill development. Professionals must first recognize the limitations of their own cultural perspective and actively seek to understand the client's cultural framework. This involves asking open-ended questions about their cultural beliefs, values, and experiences related to mental health. It also entails adapting assessment tools and techniques to be culturally appropriate, which may involve using interpreters, modifying language, or incorporating culturally relevant assessment methods. Finally, professionals must be prepared to adjust their approach based on the client's feedback and responses, ensuring the assessment process is collaborative and respectful. Question 13. The control framework reveals that a client who has researched various therapeutic approaches expresses a strong desire to engage in dialectical behavior therapy, DBT skills training, citing their struggles with intense emotions and interpersonal conflict. The clinician, while familiar with DBT, has not recently engaged in formal training or supervision specifically focused on delivering DBT skills training. What is the most ethically and professionally sound course of action? Option A. Conduct a comprehensive assessment to determine if the client's presenting issues are a good fit for DBT skills training, and if the clinician has the necessary competence to deliver it effectively, potentially seeking consultation or further training if indicated. Option B. Agree to implement DBT skills training without further assessment or consideration of personal training gaps. Assuming familiarity is sufficient. Option C. Immediately agree to implement DBT skills training as requested by the client, prioritizing their expressed preference. Option D. Dismiss the client's request for DBT skills training and unilaterally suggest a different therapeutic modality that the clinician is more comfortable with. The correct answer is A. Conduct a comprehensive assessment to determine if the client's presenting issues are a good fit for DBT skills training, and if the clinician has the necessary competence to deliver it effectively, potentially seeking consultation or further training if indicated. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for a specific therapeutic technique and the clinician's ethical obligation to provide care that is evidence-based, appropriate to the client's needs, and delivered within the scope of their competence. The clinician must navigate the client's autonomy and preferences while upholding professional standards and ensuring client well-being. The correct approach, which involves a thorough assessment to determine the suitability of dialectical behavior therapy, DBT skills training, represents best professional practice. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. It also adheres to the regulatory framework by ensuring that interventions are evidence-based and delivered competently. A comprehensive assessment allows the clinician to identify if the client's presenting issues, such as emotional dysregulation and interpersonal difficulties, are indeed well-suited to DBT, and if the client possesses the capacity to engage with the structured nature of the skills training. This ensures that the chosen technique is not only desired, but also therapeutically beneficial and safe. An incorrect approach that immediately agrees to implement DBT skills training without a proper assessment fails to uphold the principle of beneficence. It risks applying an intervention that may not be appropriate for the client's specific needs, potentially leading to frustration, lack of progress, or even iatrogenic harm if the client is not ready for or capable of engaging with the techniques. This could be seen as a failure to practice within the bounds of professional competence and a disregard for evidence-based practice. Another incorrect approach, that of dismissing the client's request outright and suggesting a different, unassessed modality, fails to respect client autonomy and the therapeutic alliance. While the clinician may have reservations about DBT, a complete dismissal without exploration can damage trust and alienate the client. This could be interpreted as a lack of professional judgment and an inability to engage collaboratively with the client's expressed needs. A further incorrect approach, that of agreeing to implement DBT skills training without the necessary training or supervision, represents a significant ethical and regulatory failure. Practicing outside one's scope of competence is a violation of professional standards and can lead to serious harm to the client. This directly contravenes the principle of non-maleficence and could result in disciplinary action by regulatory bodies. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Conduct a thorough biopsychosocial assessment to understand the client's presenting problems, strengths, weaknesses, history, and goals. 2. Evidence-based practice. Review the evidence base for various therapeutic modalities in relation to the client's specific needs. 3. Scope of competence. Honestly evaluate one's own training, experience, and competence in delivering specific techniques. 4. Collaborative goal setting. Discuss potential treatment options with the client, explaining the rationale, benefits, and limitations of each. 5. Informed consent. Ensure the client fully understands the proposed treatment plan and provides informed consent. 6. Ongoing monitoring and adaptation. Continuously monitor the client's progress and be prepared to adapt the treatment plan as needed in collaboration with the client. Question 14. Benchmark analysis indicates that when applying psychodynamic theories to client work within the CIMHP framework, a primary consideration is the optimization of the therapeutic process for client benefit. Considering this, which of the following approaches best aligns with the principles of process optimization in integrative mental health practice? Option A. Prioritizing the exploration of unconscious conflicts and defense mechanisms as the primary driver for therapeutic change, with interpretations directly guiding the client's understanding of their present-day issues. Option B. Collaboratively exploring how unconscious patterns and early life experiences manifest in current behaviors, thoughts, and feelings, and using these insights to inform client-identified goals and actionable strategies for change. Option C. Engaging in extensive exploration of the client's dreams and symbolic representations to uncover latent meanings, without necessarily linking these directly to immediate behavioral or emotional challenges. Option D. Focusing on the therapist's interpretation of the client's transference and countertransference dynamics as the central element of the therapeutic work, with the goal of resolving these dynamics. The correct answer is A. Prioritizing the exploration of unconscious conflicts and defense mechanisms as the primary driver for therapeutic change, with interpretations directly guiding the client's understanding of their present-day issues. Explanation. This scenario presents a professional challenge due to the inherent complexity of applying psychodynamic theories in a way that is both therapeutically effective and ethically sound, particularly within the framework of the certification in Integrative Mental Health, CIMHP, which emphasizes evidence-based and client-centered care. The challenge lies in balancing the depth of psychodynamic interpretation with the need for clear, actionable interventions that align with client goals and professional boundaries. Careful judgment is required to ensure that theoretical exploration does not become detached from the client's immediate needs or lead to interpretations that are not supported by the client's experience or the broader scope of integrative mental health practice. The correct approach represents best professional practice because it prioritizes a collaborative exploration of the client's internal world, directly linking psychodynamic insights to observable behaviors and client-defined goals. This aligns with CIMHP principles that advocate for a holistic understanding of the client, integrating various theoretical perspectives to inform a personalized treatment plan. By focusing on how unconscious patterns manifest in present-day functioning and how these can be addressed through conscious awareness and behavioral change, the approach respects client autonomy and promotes self-efficacy. This is ethically sound as it ensures interventions are client-driven and therapeutically relevant, avoiding speculative interpretations that could be disempowering or misaligned with the client's lived experience. An incorrect approach that focuses solely on uncovering deep-seated, unconscious conflicts without a clear link to present-day functioning or client goals represents a regulatory and ethical failure. Risks becoming an academic exercise rather than therapeutic intervention, potentially leading to client frustration and a lack of progress, which could be construed as a failure to provide competent care. Furthermore, if such exploration is not grounded in the client's expressed concerns, it may violate the ethical principle of beneficence by not actively working towards the client's well-being. Another incorrect approach that emphasizes the therapist's interpretation of the client's unconscious motivations as definitive, without sufficient client engagement or validation, is ethically problematic. This can undermine the therapeutic alliance and client autonomy, potentially leading to a power imbalance where the therapist's theoretical framework dictates the client's experience. This deviates from CIMHP emphasis on a client-centered approach and could be seen as a breach of professional boundaries and respect for the client's self-determination. The professional decision-making process for similar situations should involve a continuous assessment of the client's needs and goals, alongside a critical evaluation of how theoretical frameworks, such as psychodynamic theories, can best serve those needs. Professionals should ask, how does this theoretical exploration directly benefit the client's current functioning and stated objectives? And is this interpretation grounded in the client's narrative and observable behaviors, or is it primarily an imposition of theory? The process requires integrating theoretical knowledge with practical application, ensuring that interventions are not only theoretically sound, but also ethically responsible, client-centered, and aligned with the overarching goals of integrative mental health. Question 15. The monitoring system demonstrates a client's detailed gut microbiome analysis report, showing significant dysbiosis and an overgrowth of specific bacterial strains, alongside the client's reported increase in anxiety and digestive distress over the past 6 months. As a certified integrative mental health professional, what is the most appropriate next step? Option A. Focus solely on the microbiome data, developing a treatment plan that exclusively targets the bacterial dysbiosis, and postpone addressing the client's reported anxiety and digestive distress until the gut health is normalized. Option B. Discuss the findings with the client, exploring potential lifestyle and dietary factors that may influence gut health, and recommend evidence-based integrative strategies for stress management and general well-being, while advising consultation with a medical doctor for specific interpretation of the microbiome data and potential medical interventions. Option C. Directly interpret the microbiome report and prescribe a specific course of probiotics and probiotics tailored to the identified bacterial imbalances to address the client's anxiety and digestive issues. Option D. Inform the client that gut microbiome analysis is not within the scope of integrative mental health practice and disregard the report as irrelevant to their mental health concerns. The correct answer is B. Discuss the findings with the client, exploring potential lifestyle and dietary factors that may influence gut health, and recommend evidence-based integrative strategies for stress management and general well-being, while advising consultation with a medical doctor for specific interpretation of the microbiome data and potential medical interventions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the integrative mental health professional to interpret complex physiological data, gut microbiome analysis, and its potential impact on a client's mental health, while adhering to the specific scope of practice and ethical guidelines of the Certification in Integrative Mental Health (CIMHP) framework. The challenge lies in bridging the gap between emerging scientific understanding of the gut-brain axis and the established, evidence-based practices permissible within the CIMHP scope, ensuring client safety and avoiding overreach. Correct approach analysis. The correct approach involves recognizing the limitations of the CIMHP scope of practice regarding direct interpretation and prescription based on detailed microbiome analysis. Instead, it prioritizes a holistic assessment that integrates this information with the client's reported symptoms and existing mental health conditions. The professional's role is to facilitate a collaborative discussion with the client, explore potential lifestyle and dietary factors that may influence the gut microbiome, and recommend evidence-based integrative strategies that are within their purview, such as stress management techniques, sleep hygiene, and general dietary recommendations known to support gut health, while also advising consultation with a qualified medical professional for specific medical interpretations and interventions related to the microbiome data. This aligns with CIMHP principles of client-centered care, evidence-informed practice, and ethical boundaries, ensuring that the professional acts within their competence and refers when necessary. Incorrect approach is analysis. One incorrect approach would be to directly interpret the detailed microbiome report and prescribe specific probiotics or prebiotics based solely on the findings, without consulting a medical doctor or registered dietitian. This constitutes an overreach of the CIMHP scope of practice, as it ventures into medical diagnosis and nutritional prescription, for which the professional may not be qualified or licensed. This violates ethical guidelines by potentially providing unqualified advice and could lead to adverse health outcomes for the client. Another incorrect approach would be to dismiss the microbiome report entirely as irrelevant to mental health. This fails to acknowledge the growing body of scientific evidence supporting the gut-brain connection and represents a failure to engage with integrative principles. It also neglects a potentially valuable piece of information that could inform a more comprehensive and personalized approach to the client's well-being, thereby not providing the most effective integrative care possible within the CIMHP framework. A third incorrect approach would be to solely focus on the microbiome data and neglect the client's subjective experience and existing mental health diagnoses. While the gut-brain connection is important, mental health is multifactorial. Ignoring the client's reported symptoms and established mental health conditions in favor of a purely biological interpretation of the microbiome data would be a failure to provide holistic care and could lead to misdiagnosis or ineffective treatment strategies, violating the core principles of integrative mental health. Professional reasoning. Professionals should approach such situations by first understanding the client's presenting concerns and existing mental health status. They should then consider how emerging scientific information, like microbiome data, might intersect with these concerns. The decision-making process involves assessing the relevance and reliability of the new information within the context of the client's overall health picture. Crucially, professionals must continuously evaluate their own scope of practice and ethical obligations. When faced with information that falls outside their direct expertise or licensure, the ethical and professional imperative is to collaborate with other qualified healthcare providers, educate the client about potential avenues for further investigation, and integrate information responsibly into a broader, client-centered care plan. This involves a commitment to lifelong learning, while maintaining strict adherence to professional boundaries and client safety. Question 16. The risk matrix shows a potential for incomplete client understanding of their presenting issues if the initial mental health assessment is not sufficiently broad. Considering the principles of integrative mental health as outlined by the Certification in Integrative Mental Health (CIMHP) framework, which of the following assessment strategies best mitigates this risk while adhering to regulatory and ethical standards? Option A. Utilizing a multimodal assessment approach that integrates client self-report measures, clinician observation, a review of relevant medical history, and exploration of social and environmental factors. Option B. Conducting a structured interview focusing exclusively on the client's cognitive distortions and maladaptive thought patterns. Option C. Relying on a single, in-depth psychodynamic interview to uncover unconscious conflicts as the primary driver of the client's distress. Option D. Employing a standardized, symptom-focused questionnaire that primarily measures the severity of common mental health conditions. The correct answer is D. Employing a standardized, symptom-focused questionnaire that primarily measures the severity of common mental health conditions. Explanation. This scenario presents a professional challenge due to the inherent complexity of comprehensive mental health assessments, particularly when integrating diverse approaches within the scope of practice defined by the Certification in Integrative Mental Health (CIMHP) framework. The need to balance evidence-based practices with client-centered, holistic considerations, while adhering to regulatory and ethical guidelines, requires careful judgment. The professional must navigate potential conflicts between different theoretical orientations and ensure that the assessment process is both thorough and ethically sound, respecting client autonomy and confidentiality. The correct approach represents best professional practice because it prioritizes a multimodal assessment strategy that is directly aligned with the CIMHP emphasis on integrative care. This involves systematically gathering information across biological, psychological, and social domains, utilizing a variety of validated tools and client-reported data. This comprehensive approach ensures that all relevant factors contributing to the client's mental health are considered, leading to a more accurate diagnosis and a more effective, individualized treatment plan. This aligns with the ethical imperative to provide competent and client-centered care, as mandated by professional standards that underpin the CIMHP. An incorrect approach that relies solely on a single theoretical orientation or a limited set of assessment tools would fail to meet the comprehensive nature of integrative mental health. This could lead to a superficial understanding of the client's issues, potentially missing critical contributing factors or exacerbating existing problems. Such an approach would be a regulatory and ethical failure, as it deviates from the expected standard of care for integrative mental health professionals, potentially violating principles of beneficence and non-maleficence by providing incomplete or potentially harmful care. Another incorrect approach that neglects to obtain informed consent for the assessment process or fails to maintain client confidentiality would represent a significant breach of ethical and legal obligations. This directly contravenes fundamental patient rights and regulatory requirements governing mental health practice, undermining trust, and potentially leading to legal repercussions. Professionals should employ a decision-making process that begins with a thorough understanding of the CIMHP scope of practice and relevant ethical codes. When faced with a complex assessment, they should first identify the core domains of inquiry, biological, psychological, social, spiritual, etc., relevant to integrative mental health. Next, they should consider a range of assessment methods, selecting those that are evidence-based, culturally sensitive, and appropriate for the client's presentation. Crucially, the process must be collaborative, involving the client in goal setting and data interpretation. Finally, ongoing supervision and consultation with peers or supervisors should be utilized to ensure the assessment remains comprehensive, ethical, and aligned with best practices in integrative mental health. Question 17. Governance review demonstrates that a client seeking support for anxiety and low mood has expressed a strong aversion to traditional gym environments and high-impact exercises, preferring activities they can do at home with minimal equipment. The integrative mental health professional needs to recommend physical activities beneficial for their mental health, which approach best aligns with CIMHP principles and ethical practice. Option A. Discuss the benefits of various physical activities, including moderate-intensity aerobic exercises like brisk walking or cycling outdoors, and gentle strength training or yoga that can be adapted for home use, while respecting the client's current preferences and exploring ways to make these accessible and enjoyable. Option B. Recommend only passive stretching and mindfulness exercises, as these are the safest options given the client's stated aversion to more strenuous activities. Option C. Advise the client that without engaging in high-intensity interval training, their mental health benefits will be significantly limited, and suggest they reconsider their preferences. Option D. Insist on the client attending a gym for structured aerobic classes, as this is the most scientifically proven method for improving mood and reducing anxiety. The correct answer is A. Discuss the benefits of various physical activities, including moderate-intensity aerobic exercises like brisk walking or cycling outdoors, and gentle strength training or yoga that can be adapted for home use, while respecting the client's current preferences and exploring ways to make these accessible and enjoyable. Explanation. This scenario is professionally challenging because it requires the integrative mental health professional to balance the client's expressed preferences with evidence-based recommendations for physical activity, all while operating within the ethical and regulatory framework of the Certification in Integrative Mental Health. CIMHP. The challenge lies in discerning when a client's resistance to certain activities might stem from underlying mental health barriers that need addressing, rather than simply personal preference, and how to ethically guide them towards beneficial interventions without overstepping professional boundaries or violating client autonomy. Careful judgment is required to assess the client's readiness, potential contraindications, and the most effective, least intrusive approach. The correct approach represents best professional practice because it prioritizes a holistic, client-centered, and evidence-informed strategy. It acknowledges the client's current limitations and preferences while gently introducing a broader spectrum of beneficial physical activities. This approach aligns with CIMHP principles by focusing on the integration of physical well-being with mental health, recognizing that different forms of movement can impact mood, energy, and cognitive function. It also adheres to ethical guidelines by respecting client autonomy while providing professional guidance and education, empowering the client to make informed choices that support their mental health goals. The emphasis on starting with enjoyable, low-impact activities builds confidence and adherence, a cornerstone of effective therapeutic intervention. An incorrect approach that focuses solely on high-intensity aerobic exercise fails to acknowledge the client's current state and potential barriers. This could lead to discouragement, avoidance, and a negative association with physical activity, hindering progress. Ethically, it disregards the principle of do no harm by potentially overwhelming the client. It also fails to adhere to CIMHP integrative approach by not considering the client's individual needs and preferences. Another incorrect approach that dismisses the client's preferences and insists on specific, potentially disliked activities is ethically problematic, as it infringes upon client autonomy and self-determination. This can erode trust and damage the therapeutic relationship, making the client less receptive to any recommendations. It also demonstrates a lack of understanding of the psychological barriers that can impede engagement with physical activity. A third incorrect approach that solely recommends passive activities, like stretching without exploring more dynamic options, overlooks the significant mental health benefits of moderate-intensity aerobic exercise and other forms of movement that can improve mood and reduce anxiety. While stretching has its place, it may not provide the full spectrum of benefits that a more integrated approach to physical activity can offer for mental well-being. This approach fails to fully leverage the evidence base for physical activity in mental health. The professional decision-making process for similar situations should involve a thorough assessment of the client's current physical and mental state, their history with physical activity, their preferences, and any potential barriers. This should be followed by an educational discussion about the various types of physical activity beneficial for mental health, tailored to the client's individual circumstances. The professional should then collaboratively develop a plan that starts with activities the client finds accessible and enjoyable, gradually introducing more challenging or varied options as appropriate, always prioritizing client engagement and well-being. Question 18. Market research demonstrates a growing interest in integrative mental health services for anxiety disorders. A new client presents with moderate generalized anxiety disorder, reporting significant distress and functional impairment. They have previously undergone cognitive behavioral therapy, CBT, with some benefit but are seeking a more holistic approach. Considering the principles of integrative mental health and a comprehensive risk assessment, which of the following approaches best aligns with best professional practice for this client? Option A. Advise the client that only traditional, evidence-based therapies like CBT are considered safe and effective for anxiety disorders, and that integrative approaches lack sufficient scientific validation. Option B. Propose a treatment plan that exclusively utilizes novel, cutting-edge integrative therapies that have shown preliminary promise in anecdotal reports, without a strong emphasis on established traditional modalities or formal risk assessment. Option C. Suggest that the client discontinue all previous therapeutic interventions and focus solely on a single, highly specialized integrative modality that has recently gained popularity in online wellness communities. Option D. Recommend a treatment plan that combines evidence-based traditional therapies like CBT with carefully selected integrative interventions, such as mindfulness-based stress reduction and targeted nutritional counseling, following a thorough assessment of potential interactions and contraindications. Correct answer is D. Recommend a treatment plan that combines evidence-based traditional therapies like CBT with carefully selected integrative interventions, such as mindfulness-based stress reduction and targeted nutritional counseling, following a thorough assessment of potential interactions and contraindications. Explanation: this scenario presents a professional challenge because it requires a mental health practitioner to navigate the evolving landscape of mental health treatment, balancing established, evidence-based traditional modalities with emerging integrative approaches. The core of the challenge lies in accurately assessing the risk profile of a client seeking treatment for anxiety, considering both the potential benefits and limitations of each treatment paradigm. Careful judgment is required to ensure the chosen approach is not only effective, but also ethically sound and compliant with the regulatory framework governing integrative mental health practice. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that considers the client's specific presentation of anxiety, their personal history, and their preferences, while also evaluating the evidence base for both traditional and integrative interventions. This aligns with the ethical imperative to provide client-centered care and to practice within the scope of one's competence, as guided by the Certification in Integrative Mental Health (CIMHP) framework. A thorough risk assessment allows for the identification of potential contraindications or adverse effects associated with any intervention, traditional or integrative, and facilitates informed consent. This approach ensures that the practitioner is making decisions based on a holistic understanding of the client and the available treatment options, thereby maximizing safety and efficacy. An incorrect approach that focuses solely on traditional modalities, without considering the potential benefits of integrative therapies, would fail to uphold the CIMHP commitment to exploring a broader spectrum of evidence-informed interventions. This could lead to suboptimal care if integrative approaches, such as specific nutritional interventions or mindfulness-based stress reduction, are demonstrably effective for the client's particular presentation of anxiety and are within the practitioner's scope of practice. Another incorrect approach that exclusively embraces novel or unproven integrative techniques without a robust risk assessment and consideration of established traditional treatments would be professionally unacceptable. This would violate the ethical principle of do no harm and could expose the client to ineffective or even detrimental interventions. Such an approach would also likely fall short of the rigorous evidence-based standards expected within the integrative mental health field, potentially leading to regulatory scrutiny if it deviates from established guidelines for client safety and treatment efficacy. The professional decision-making process for similar situations should involve a systematic evaluation of the client's presenting problem, a thorough review of their medical and psychological history, and an assessment of their readiness for change and treatment preferences. This should be followed by a critical appraisal of the evidence supporting both traditional and integrative interventions relevant to the client's condition. The practitioner must then integrate this information to formulate a personalized treatment plan that addresses the client's needs, prioritizes safety, and is developed with the client's informed consent. Continuous monitoring of the client's progress and a willingness to adapt the treatment plan based on their response are also crucial components of best professional practice. Question 19. Market research demonstrates a growing public interest in understanding how chronic stress impacts cognitive function and emotional regulation. A client presents with significant difficulties concentrating, increased irritability, and reports feeling mentally foggy for several months, attributing these symptoms to ongoing work-related pressures. As a certified integrative mental health professional, what is the most appropriate initial course of action to address the client's concerns regarding stress and brain function? Option A. Immediately recommend a course of a specific herbal supplement known for its purported cognitive-enhancing properties, based on anecdotal evidence from online forums. Option B. Conduct a comprehensive assessment of the client's lifestyle, stress triggers, coping mechanisms, and sleep patterns, and collaboratively develop a personalized plan incorporating evidence-based integrative strategies such as mindfulness, stress reduction techniques, and nutritional guidance, while advising the client to consult with a physician for a medical evaluation. Option C. Suggest the client undergo intensive neurofeedback therapy, as this is a direct method for retraining brainwave patterns affected by stress. Option D. Advise the client to seek a prescription for a stimulant medication from their primary care physician to address the reported concentration difficulties. The correct answer is B. Conduct a comprehensive assessment of the client's lifestyle, stress triggers, coping mechanisms, and sleep patterns, and collaboratively develop a personalized plan incorporating evidence-based integrative strategies such as mindfulness, stress reduction techniques, and nutritional guidance, while advising the client to consult with a physician for a medical evaluation. Explanation: this scenario presents a professional challenge because it requires an integrative mental health professional to apply their understanding of stress's impact on brain function within the specific ethical and regulatory boundaries of the Certification in Integrative Mental Health (CIMHP) framework. The challenge lies in translating complex neurobiological concepts into actionable, client-centered interventions that are both effective and compliant. Careful judgment is required to ensure that recommendations are evidence-based, client-appropriate, and do not overstep the scope of practice or make unsubstantiated claims. The correct approach represents best professional practice because it prioritizes a holistic, client-led assessment that integrates the client's subjective experience with objective, evidence-based understanding of stress physiology. This approach aligns with CIMHP principles by emphasizing the interconnectedness of mind, body, and environment, and by empowering the client in their healing journey. It adheres to ethical guidelines by ensuring interventions are tailored, informed consent is obtained, and the professional maintains appropriate boundaries, focusing on education and skill building rather than prescriptive medical advice. An incorrect approach that suggests immediate pharmacological intervention without a comprehensive assessment by a qualified medical professional would represent a significant regulatory and ethical failure. This oversteps the scope of practice for an integrative mental health professional, potentially leading to harm if medication is not indicated or if it interacts negatively with other treatments. It also fails to uphold the principle of client autonomy by not fully exploring less invasive, integrative strategies first. Another incorrect approach that focuses solely on a single, unproven miracle cure for stress-related brain dysfunction would be ethically problematic. This could be considered a misrepresentation of services, potentially exploiting a vulnerable client by offering false hope and diverting them from evidence-based care. It violates ethical obligations to provide accurate information and to practice within the bounds of established scientific understanding. A third incorrect approach that involves recommending complex neurofeedback protocols without proper training, certification, or a clear understanding of the client's specific neurological profile would also be a regulatory and ethical failure. This could lead to ineffective or even detrimental outcomes for the client and demonstrates a lack of due diligence in ensuring competence and appropriate application of advanced techniques. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the client's presenting issues, including their subjective experience of stress and its perceived impact on their cognitive and emotional functioning. Second, consult current, evidence-based literature on the neurobiological effects of stress and validated integrative interventions. Third, collaboratively develop a personalized plan with the client, outlining potential strategies, their rationale, and expected outcomes, ensuring informed consent. Fourth, continuously monitor the client's progress and adjust the plan as needed, always operating within the scope of practice and ethical guidelines of the CIMHP framework. Question 20. The efficiency study reveals that clients presenting with moderate anxiety and a history of trauma respond most favorably to a combination of cognitive behavioral therapy, CBT, and mindfulness-based interventions. A new client presents with similar symptoms, expressing a strong preference for exploring somatic experiencing techniques and a skepticism towards traditional talk therapy. Considering the CIMHP framework, which of the following approaches best aligns with ethical and effective integrative mental health practice? Option A. Immediately implementing a protocol of CBT and mindfulness-based interventions as indicated by the efficiency study, explaining to the client that these are the most effective approaches regardless of their stated preferences. Option B. Focusing exclusively on somatic experiencing techniques, as this is the client's preferred modality, without integrating other evidence-based approaches for anxiety management or considering the broader evidence base for trauma treatment. Option C. Recommending that the client seek a different practitioner who specializes solely in somatic experiencing, as the clinician's expertise is primarily in CBT and mindfulness, and the client's preference deviates from this established expertise. Option D. Conducting a thorough assessment to understand the client's specific trauma history, symptom presentation, and preferences, then collaboratively developing a treatment plan that integrates evidence-based modalities, potentially including somatic experiencing if deemed appropriate and within the clinician's competence, alongside other evidence-supported interventions for anxiety. The correct answer is D. Conducting a thorough assessment to understand the client's specific trauma history, symptom presentation, and preferences, then collaboratively developing a treatment plan that integrates evidence-based modalities, potentially including somatic experiencing if deemed appropriate and within the clinician's competence, alongside other evidence-supported interventions for anxiety. Explanation. This scenario presents a professional challenge due to the need to balance evidence-based practice with client autonomy and the ethical imperative to provide care that is both effective and respects individual needs within the scope of integrative mental health. The clinician must navigate the integration of diverse therapeutic modalities, ensuring that the chosen approaches are not only theoretically sound, but also practically applicable and ethically permissible according to the Certification in Integrative Mental Health (CIMHP) framework. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that informs a personalized treatment plan. This aligns with CIMHP principles that emphasize a holistic understanding of the client, considering their biological, psychological, and social factors. The integration of evidence-based modalities, tailored to the individual's unique presentation and preferences, demonstrates a commitment to client-centered care and adherence to ethical guidelines that mandate competence and beneficence. This approach ensures that interventions are not only potentially effective, but also delivered in a manner that respects the client's agency and promotes their well-being. An incorrect approach that relies solely on a single, unproven modality, without considering the client's broader needs or established evidence bases, would represent a failure to adhere to CIMHP emphasis on evidence-informed practice and a potential violation of the ethical principle of non-maleficence. Similarly, an approach that dismisses the client's expressed preferences or cultural background in favor of a rigid, predetermined protocol would contravene the ethical requirement of respecting client autonomy and dignity. Another incorrect approach might involve the uncritical adoption of a novel modality without adequate training or supervision, which would violate the ethical standard of practicing within one's scope of competence. A professional decision-making process for similar situations should involve a systematic evaluation of the client's presenting issues, a thorough review of relevant evidence for various therapeutic modalities, consideration of the client's values and preferences, and an assessment of the clinician's own competencies. This iterative process ensures that treatment decisions are informed, ethical, and client-centered, fostering a collaborative therapeutic relationship.